Yes, hi. This is my master thesis, the effects of the comfort and anxiety of the elderly living nursing home. The importance of the music therapy and the effects on the patients, recovery with MPEG by Florence Nightingale in the 19th century and recognized as a nursing approach which reduces pain and anxiety and increases the patient's comfort. Comfort, which includes relief, achieving tranquility, and ability to overcome problems, is a subjective concept. One way of making this concept as objective as possible is the ability to measure it. According to the Koljaba's comfort theory, nurses identify the comfort needs of the individuals in a stressful healthcare environment and implement nursing approaches to increase comfort concerning unmet needs, evaluating the effects and which they achieve the results of the emulation, anxiety, and reducing its a minimum. Yes, the anxiety can be seen as one of the basic human emotions. Nurses who are in the contact with the residents of the old people's homes will naturally act as a guide to the old people in reducing anxiety levels and increasing the comfort. Examining the literature, we find studies of the use of music with patients in intensive care units and various clinics in the hospital environment, but we came across no studies examining the effect of the music on comfort and anxiety, especially on the residents of the elderly living home. Examining the effect of the music on the residents of the elderly living nursing home. Type of the research, this was a randomized controlled experimental study with pre-test, post-test, and a control group. The study was conducted at an Izmir municipality old people's home between 15 December 2030 and 15 May 2014. Yes, population and sample, including the criteria were being over the age of 60, literate, Turkish speaking, having no hearing problem, having no normal cognitive functions, not having been exposed to the environmental factors through the attack of the comfort of the old people, for example, 3 or more people living one room, heat, light, noise, and not having recently suffered an attack of the chronic illness, not having suffered an acute illness such as flu in the past 3 days, showing normal vital signs, not having a diagnosis of the Parkinson's, Alzheimer's, dementia, or major depression. Randomization is the old people's randomization according to the age and sex by the drawing laws. Not having the part of in the study is the 5 people, withdrawing from the study because of the problems with recording keeping during the application 8 people, exposed to the negative environmental factors and 2,018 people, recently experiencing an attack of the chronic illness 2 people, having a hearing problem 3 people, not having normal cognitive functions according to standards mental test 5 people, and diagnosis with Parkinson's, Alzheimer's, dementia, and major depression 5 people. A total of the 28 people were excluded from the study. Of the 2,064 residents of the old people's homes, and 56 people were included in the study and formed in the richest sample, 28 in the experimental group and 28 in the control group. Data collection with the old people's identification forms with 7 questions to collect the characterizing information on the old residents of the home. And anxiety levels were measured with the items, 21 items, the Beck anxiety scale developed by Beck and tested for validity and reality in Turkey by Ulusoy. A higher total levels shows that a higher anxiety levels. The old people's comfort levels were measured using a general comfort scale developed by Koljaba in 1992 and Tests for Validity and Reality by Kuoğlu and Karabacak. The scale with 48 items, 24 conducting positive statements, and 24 with negative statements. The old people were monitored for 22 days. The control group received no intervention. On the first day, the identification form was applied. On day 1, 8, 15, and 22, the back anxiety scale and the general comfort scale were applied. In the experimental group, on the first day, the identification form, the back anxiety scale, and the general comfort scale were applied before the application of music. An expert music teacher was consulting the determined music which would be restful for the old people, and a piece of Turkish classical music was chosen for its relaxing effect. 13 minutes of the music was played to the experimental group between 20 to 22 for 22 days. On days 18, 8, 15, and 22, the general comfort scale and the back anxiety scale were applied. Examining the relevant literature, it was seen that music had been played to this age group periods of the 25 and 15 minutes. In the literature, music had been played to the old people between 20 and 22 as the most suitable time after they had completed activities such as shopping or eating supper. In order to provide motivation and to make the experience more memorable, their plans were used with the old people, and they check it like this. It's for memorable. And the pension variables the old people's total mean scores on the back and comfort scales. Independence variables the old people's age, gender, marital state, education level, chronic illness, environmental factor, and music. The difference between groups by weeks was examined with the Mamigny-U test, and the difference between total mean scores between weeks was examined with least significant difference analysis. The study was performed according with ethical principles. Written permission was obtained from the Nursing Faculty Scientific Ethics Committee, and informed consent was obtained from the participants. As the findings, total mean scores was description of the experimental and control groups on a general comfort scale by weeks. A statistically significant difference was found between total mean score on the general comfort scale of the old people in the experimental group, and no significant difference was found between total mean score on the general comfort scale of the old people in the control group by weeks. And the difference between weeks of the mean of the total comfort score of the experimental group were examined. No significant difference was found between weeks 1 and weeks 2, but a significant difference was found between weeks 1, between weeks 2 and 4. There was a significant difference between weeks 2 and weeks 3, 4. As a significant difference between was also found weeks 3 and 4. In control group, no significant difference all of the weeks between all of the weeks. Distribution of the total mean scores on the back anxiety scale of the old people in the experimental group and the control group by weeks. A significant difference was found between the experimental group. As we can see, it's the significant difference, but in the control groups, no significant difference by weeks. Distribution of the difference between weeks of the total mean scores on the back anxiety scales of the old people, experimental and control groups. We see that the first week between the weeks 3, a significant difference found the experimental group, and weeks 1, weeks 3, significant difference. All the weeks in experimental group is a significant point, but the experimental group, the control group, there is no significant was point in this study. And the total mean scores on the back anxiety scale of the experimental and control groups by weeks. Look these graphs. The blue one is the experimental group, and the red one is the control group. And first the study is higher and listen to the music, and it is the lower than the control group. That's the results. According to the findings of the study, music increased the comfort and decreased the anxiety levels in the old peoples in the experimental group. But no significant change was seen in the comfort or anxiety levels among the old people in the control group. In studies on music therapy, it has been found that music has effect of the reduction in the anxiety levels and increasing the comfort levels felt by the patients. However, a scan of the literature showed that other studies on music therapy have generally been conducted in intensive care units and hospitalized patients. Previous studies support the findings of our studies, despite difference in sampling and methods. Yes, the Turkish classical music can be played to the old people to help reduce their anxiety levels and increases their comfort. Nurses working in the old people's homes can make use this effect and include it their nursing practice. Yes, thank you for all.
Thank you, Master of Science, Ms. Eda. Does anyone have any question or comment to her? Okay, please.
I want to know about the confounder variable in your research. Is there any confounder variable in your research? Same as visit of relatives, visiting of relatives.
I visit
Did the old man or old women visited their relatives during the intervention?
First, there is a criteria, and out of the criteria, people I speak, and if they want to do these studies, they check the hani control group A ve B diye böyle ayırdım ben. A grubuna uygulama grubu, B grubuna, A grubuna uygulama grubu, B grubuna kontrol grubu yazdım. Onlar kendi işlerinden seçtiler. Hangi gruba girmek istiyorsa o grup oldular. Randomizasyonu mu soruyor yoksa?
Please give her the mic.
Implementation group choose as a randomized system. Okay?
Please speak English. We should want to listen to your advice.
I am sorry, I couldn't listen to her presentation, so I try to translate to her because I would like to say the best answer to them. So,
Did you catch all point? Did you catch all point?
Anlamadım. Ne diyor?
she told us the samples is decide to which group would like to be in the sample. So, for example, she asked the group, the participants to her study, which group do you prefer to attend for this implementation? And participants decided in this subject which group they will be on this sample.
Thank you. I think the main question is, because in